for joining us. Again, my name is Carla. I'm the Director of Education and Partnerships here at NeedyMeds, and we appreciate your taking time out of your day to join us for today's special topic webinar, RX Outreach, Making Medications Affordable. Before we kick off the presentation, I want to go over just a few tips. You can feel free to ask questions at any time throughout the presentation by sending them to me into that questions section in your GoToWebinar control panel. Just know that we will reserve answering questions until the end. If we don't have the time to answer your specific question, don't worry, we will follow up with you personally via email. Of course, the contact information for both NeedyMeds and RX Outreach will be provided at the end. And this webinar is being recorded and will be available for viewing on the NeedyMeds YouTube channel. There are also copies of the PowerPoint presentations in the handout section of your GoToWebinar control panel. So with that, let's get started. For those of you not familiar with NeedyMeds, what you're looking at on your screen now is our mission statement and how we achieve our mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, which is 1-800-503-6897. And of course, I will provide that contact information at the end as well. And I always like to put up a screenshot of our website because it's really the face of our organization. And just a couple of things I want to point out. If you visit our website and you're looking for healthcare cost savings resources, you will find those under the Patient Savings tab. I mentioned just a moment ago that this webinar is being recorded and will be available on our YouTube page, and you can find that on the top right of our home page with the rest of the social media icons. It's the third one from our left. Also, our monthly e-newsletter, formerly known as Patient Assistance News, has a new look and a new name, Vitals, and we hope you subscribe to it by clicking on the subscription center link so you can stay up to date on the latest from NeedyMeds. And the subscription center link can also be found on the right-hand side, and you can find a link to Vitals, that monthly newsletter, also under that Advocates tab. And of course, you can find a link to our partner, RX Outreach, on the right side of our home page, which brings us to today's webinar. Again, RX Outreach, Making Medications Affordable. So as you saw in our mission statement, an important part of what we do here at NeedyMeds is educating people. And we define that in two ways: by letting people know about NeedyMeds and the resources we have to offer, but also by letting them know other ways to save on their healthcare expenses, which is why we are so pleased to have our guest panelist here with us today. It's my pleasure to introduce Pete Wyatt from RX Outreach. So first, let me tell you a bit about RX Outreach. Simply put, they are a nonprofit pharmacy whose mission is to provide affordable medications. And sometimes just that statement alone stops people in their tracks. An actual nonprofit pharmacy. So that's why you're here today, because Pete's going to walk you through what that means and how it will be important to you, your family members, the patients you serve, and really anybody that needs help affording their medications. So that's a little bit about RX Outreach. Now let me tell you a bit about our guest, Pete. Pete heads up the marketing and provider relations team for RX Outreach. His team's primary goal is to share and serve low-income patients and their providers, helping to ensure that those in need of affordable medication have access. So without further ado, and hopefully seamlessly, bear with me because I'm going to go ahead and pass the mic and the screen to Pete. So there may be just a moment while we make that transition happen. But in the meantime, I'll remind everybody that if you do have questions, you can go ahead and submit them into that question section of your GoToWebinar control panel. And just a reminder also, if we don't get the chance to answer your question, don't worry, we'll follow up with you via email. So with that, I'll pass the mic and the screen to Pete. Thanks, Pete.
Thanks a lot, Carla. Hi, everyone. I hope everybody can see the screen. It has not always been the case. Um,
Yes, we are. I'm just going to interrupt to say, absolutely, we're good to go. Thanks for checking in, Pete.
okay, I have passed that test. Okay, for those of you who do not know who RX Outreach is, um, we are real. We are very real. We exist in St. Louis, Missouri, and we have a lot of opportunities for a lot of different types of people. So, what you're going to hear today is an extremely high level overview of what we are and what we do. And in that, we hope we are generating questions that are specific to you um, because everybody's need is a little different. Some of you are patients, some of you are nurses, some of you are providers. So we can't give one specific presentation to everyone, but we want to create the opportunity for everybody to be served and get their questions needed, so or get their questions answered as needed. So what we're going to talk about today is what is RX outreach. Sometimes we say who, but what is as important? When to consider RX outreach, why to consider RX outreach, and how to use RX outreach. And again, we try to simplify each one of these in hopes that the simplified information generates specific questions from you and or your organization. So what are we? RX Outreach is the nation's largest, because we're the only, uh, fully licensed nonprofit mail order pharmacy serving the poor. As you can see down in the lower right hand corner, we are not a remodeled um, home with retired pharmacists scraping pills and bottles. Um, we realize that those are very important to community relations, but we are 31,000 square feet of fully automated space, taking 8,000 phone calls a week and putting out approximately 8,000 prescriptions a week. And we've got capacity to grow. So that's what we are. We are mission to work with safety net providers to serve those in need of affordable medication. It is not our goal for you safety net providers out there who have local pharmacy relationships, who have dispensaries in house. It is not our pursuit to replace anything you have. It is our mission as a nonprofit pharmacy to subsidize what you have. Every practice, everybody has somebody that is going to fall through that net. We are just one more stop on the road on the continuum of medication access that ensures that that person has one more shot at getting the medication that they need. We serve all 50 states. That includes Puerto Rico and the Virgin Islands. Yes, we do business in all 50 states. Yes, we are licensed in all 50 states. And yes, we are managed and restricted, and we comply as all pharmacies do. We report to 34 of those states every day and all 50 of them every week. So that is something that we are obligated to do. So there's no concerns about that. We have more than 500 medications. That number actually just crossed 600 at the end of last year, and we have 1,200 different medication strengths. So as you look at your local pharmacy relationships, as you look at your dispensaries, again, our objective is not to replace what you have, but in the cases where you're using something that is not quite the right dosage or not the right medicine, we by chance may have it because our formulary is sizable, and we would certainly like to help your patient get in it so that they have the medications they need so that they can live stable lives. As I stated before, we do more than 350,000 prescriptions um, a year here. That number is going up drastically, a lot this year. 8,500 of those prescriptions were direct referrals from NeedyMeds. So, as Carla alluded to before, we value the partnership of NeedyMeds. We appreciate being with all of you, and we appreciate being with NeedyMeds. One of the things that we are not, we do not require a coupon. Our pricing, if you go to rxoutreach.org, and you view our formulary, that pricing is public. That pricing is without coupon. If you qualify for our program, if your patients qualify for our program, that is the price they pay delivered. So there is no coupon. As an extension of that, we are not a discount card. We don't offer one. We are not one. We honor one, and that one Carla will tell you about a little later. It's not that we honor it, we take it here. We don't take it here, but it's the one card that we think is beneficial to the patients that we serve, because many of them are not. So when do you want to consider RX Outreach? If you are a provider, advocate, or a clinic, we are good for you when you have exhausted all options for free medication. It is important to us that the people we serve find that medication free. There are many sources out there that will provide it locally, nationally, regionally, that provide free medication. We want your patients or yourself, and if that's you, to find it free. However, the issue with free is that it runs out. The issue with free is it's not the right dosage. The issue with free is when back orders happen. The issue with free is the program ended. All of those kind of things. And in a lot of occasions, more times than we'd like to acknowledge, when our patients run out of free medication, that's not a simple thing. That's not a get in your car and go to Walgreens. That means that their lives are now beginning to unravel, and they need to find a free replacement or an affordable replacement. And that's when we step in to help and support. Another reason is when the patient does not qualify for a PAP or Medicaid or any kind of governmental assistance or any kind of local assistance. There are hundreds of thousands of these particular patients. They don't make enough money. They don't want to participate in the government system. For whatever that is, we do not require paperwork, insurance, all of those kind of things. The only thing that we require is a prescription from a licensed provider that states that this particular individual needs gabapentin, and they would like to pay the affordable price. That's it. Transitioning into the next one, when the patient does not have any documentation, we don't need it. The four things that we need is the patient's name, the patient's address, the patient's prescription that we get from the provider. We cannot take it from the patient, and the payment. Those are the only four things we need. So we're not running down income tax statements, check stubs, green cards, visas, passports, driver's license. We're not doing all those as requirements to qualify for the program. Another opportunity is when the existing pharmacy relationship does not have the needed preferred medication restraint. Again, going back to what we spoke to before, we think it's important that you can find that medication for your patient free. That's important. We also believe in the power of local relationships. That pharmacy down the street, the pharmacist that went to school with you, those relationships are extremely important. What we want to be for those relationships is the pricing barometer. We have lots of local pharmacy relationships that were, shall we say, they were good relationships for a long period of time because the provider felt like they were getting good pricing. However, when they checked our pricing, their local pharmacy was not as low cost as we were, and it's caused a few problems in the sense that we're available and the pharmacy didn't want to meet the pricing and the relationship got upset. But we want that pharmacy relationship for you. It's important. Our mission is to make sure that you can find the medication as inexpensively as possible. And the last thing to consider here is when the patient's compliance is threatened by mobility. If you are rural, if you have patients that are rural, 30 miles from the clinic, 40 miles from the clinic, all of those kind of issues, if you have a patient that is urban and is housebound, all of those things. If they have a mailbox or a secure facility in which we can mail it, we serve those patients and help you keep them compliant. In the case where patients do not want, or in the case where the provider does not want that patient medication sent to the patient, we send it to the clinic so that the clinic can have the patient come in for their monthly visit, 90-day visit, so that that compliance conversation can be had and that patient can be monitored. If you are the patient or the caregiver for a patient, and we have a lot of sons and daughters that are taking care of their older patients, the reasons to consider us from that perspective are pretty much the same. If the first one is a slightly different, but this one is, if you are spending any of your money on medications, it makes sense to check us out. For the very reason that if you're on a program and you have all you have to do is pay the copay for the medicine, and you go and you pay $20 and you get you get 30 days worth of medicine, we think that's great. If you're spending that $20 as a copay as a part of insurance or program or anything like that, consider that same $20 for 90 days of medication. How much further is your money going? We run into it a lot. People are afraid that if they use us to save money, that they affect their insurance or they affect their Medicare or their Medicaid. They do not. This is just a diversion of the cash, of the money out of your pocket that will go toward the same medication for 3 times as long. Again, when you do not qualify for PAPs, we kind of covered that. When you don't have documentation, when you have more than one medicine, this is a big issue for the poor. The provider says, I have your medicine at one retailer for $7. I have your medicine across town for $4. Both of those meds are in 2 different spaces. You might have, a lot of cases, you might have 2 or 3 more meds. It becomes a value proposition at that point in time. Do you want to send that patient all over the city every 30 days? Or do you want to have that patient pay maybe slightly more, maybe not, in some cases it's actually less when you do the math, to have all of their medications sent to the clinic that they can pick up at once or sent directly to their home? So as you guys know, one of the biggest barriers is I've got multiple meds, they're at multiple pharmacies, I don't have a car, I have to wait on my daughter, all of those kind of things. So that's one other reason to consider us. And then again, when your patient or your caregiver is challenged by mobility, we can help with that by getting it to the clinic if the clinic provides mobility services, or we can get that to their home under the supervision of the clinic. Why RX outreach? We kind of went through this a little bit as we go through. We are mission to focus on the patient. If we were for profit, we would be mission to sell our medications. We want to make sure that our patients get it first, free, then affordably. And in this continuum of medication, there are free sources, for those of you that know about AmeriCares and Direct Relief. There are several kinds of affordable sources, different kind of programs. There's Dispensary of Hope, there's RX Outreach, and there's a few others. And then you have discount cards, coupons at local retailers, and then you have straight retail. So this continuum is significant, but we are unique in that we are mission to serve you with a large formulary and make sure that patient is okay. We are transparent. The medication price that you see is the delivered price. So if it's $20 for 90 days, there are no additional hidden fees, there are no additional fees, there's no enrollment fees, there's no membership fees, there's no shipping fees, and there's no requirement for you to stay a member of our program. If you need us once, fine. If your practice has 1,500 patients in it, and you have one patient that is falling through the cracks this one time, That's fine. We are here. We are transparent. There's nothing that we provide that cannot be seen. We serve the uninsured, the underinsured, and the insured with household incomes below 300% of the FPL. Again, as I stated earlier in the presentation, we don't care where they're coming from or what they haven't been able to get. If we are cheaper for that patient that qualifies and they are insured, great. If they are uninsured, great. We don't care. Our concern is that we are missioned to help that patient remain stable and compliant with a medication that they can afford. We are a sustainable source of 90 and 180-day supplies. One of the things that we also just opened up a 30-day formulary, and that's going to expand as we move through the year. But we say sustainable because RX Outreach buys medication directly from manufacturers. We do not, in significant ways, accept donated product because donated product runs out. We want to be sustainable, so our business model is we buy 85, 87% of our medications every year so that when your patients or when you need that medication, the price has not gone up this week and the medication is on our shelves that can be with you in 3 to 5 days. We are committed to serving and supporting NeedyMeds and its constituencies. As I said before, NeedyMeds is a very, very, very important resource in terms of those people seeking help with their medications, with their medical needs. We believe in them. We will partner with them for a long time. And as constituents of theirs, you're in good hands. So how to use us? The patient must be enrolled. Enrollment is very simple. We talked about the 4 things we need. There are some things that we verify, but we don't need Social Security numbers. We need those 4 things. I should say we don't need Social Security numbers for standard meds, but we do need them on controls. But those 4 things can be clinic initiated or patient initiated. They can be utilized online. You can call us, you can mail it in. But they are the name, patient name. They are the patient address. They are the patient prescription or the patient medication that we may have it. And then there's the payment. So that's all that's required to be enrolled. You enroll every year or re-enroll every year, but that is not an obligation to buy from us. That is only so that we know that you are enrolled in the program. Submit prescriptions by fax, e-prescribing, or mail. Again, they come in from the provider. So if you are an individual out there today, we cannot take your prescription directly. However, if you call that prescription in with your doctor information, we call that doctor and the doctor will submit that same prescription to us same day so that we can process. We will process your account immediately upon request. However, we will ship it only after payment is received. Payment is made in several ways. We say we're a cash pharmacy, but we have an abundance of ways which people can pay for their medications, or providers can pay for the medications. We have various programs for providers. We have various programs for patients. But after payment is received and verified, that medication is shipped. We require payment up front because we can't get that medicine back. So, and that's how we keep our doors open here. Refill and prescription renewal reminders are sent directly to the patient, unless otherwise directed by the provider. So with that very tall overview, I hope it has generated a few questions. I am giving you the presentation today, but I can confirm for you without a doubt that the 2 brains behind this particular aspect of our business are Erica Black, her number is there, and Susan Fodor, her number is there. Both of them are at your service to give them a call directly there. We're not asking you to go through our call center and wait. You can call those 2 directly with any questions that we don't get answered here today. My number is there as well, but I am rarely here and I'm rarely at my desk. And you guys know how that is if you're moving around and if you need a question answered right away. I am not the best for right away. Erica and Susan are. So with that, I thank you, and I turn it back to you, Carla.
Thank you so much, Pete, for that very thorough explanation of what RX outreach is. And hopefully, our audience got a sense of the breadth and scope with which how much RX outreach helps people, and will mirror the sentiment that we are so proud to be considered a partner of RX outreach. I will remind everybody that you can feel free and submit questions. I do see a bunch of them coming in into that question section of your GoToWebinar control panel. And before I ask Pete to respond to those questions, I do want to remind you that NeedyMeds is also here to support you getting the medications you need. What you're looking at on your screen is a snapshot of some of our most popular and cost-effective ways to save on your medications. You can reach out to us by visiting our website and checking out that patient savings tab, or of course, giving our expert call center counselors a call, and that number is 1-800-503-6897. Reminder that we are on the East Coast. We're in Massachusetts, so we're open Monday through Friday, 9 to 5 Eastern Time. So I'm going to go ahead and leave the contact information for Pete and his colleagues, Erica and Susan, in case you do have questions after this webinar. And I will mirror what Pete often says about RX outreach. The easiest thing sometimes to do is just to give them a call, and I'll say that's true about NeedyMeds as well. So I'm going to go ahead and leave that screen up, providing you with our contact information, and remind everybody that the PowerPoint presentations, Pete's most importantly, as well as mine, can be found in that handout section of your GoToWebinar control panel. So let's get to some of the questions coming in. One thing, Pete, that comes up a lot is we usually have an audience member just ask you to really reiterate this, which is how much does RX outreach cost, both to the patient and the provider?
Okay, great question. For the provider, there are no membership fees, there are no costs involved with the provider, unless the provider is paying for the medication for the patient. So the cost here, Carla and everyone who's listening, the cost is only for the medication you need. So if you have one medication and it's $20 for 90 days, that's your cost. If for some of our more frequent users, we have a program that we will invoice them at the end of the year, or at the end of the month, I'm sorry. That cost is the accumulative cost of all the prescriptions that we've written in the month. So there are no service fees, there are no membership fees involved with our service.
Great. Thank you again for such a thorough response, and to our audience member for asking that. That's something that we often have to repeat, because it's almost unbelievable that when you stress, Pete, that the pricing is completely transparent. Like everybody else probably listening in, I needed to drive that point home for myself as well. Another question coming in is actually about NeedyMeds and our drug discount card. Thank you for asking about that. You saw on that slide I had up some of our most popular and cost-effective ways to save on your medications. And at the bottom of that list, there was a reference to our drug discount card, and Pete also referenced it in his presentation. You can use the NeedyMeds drug discount card if you're not able to get your medication through your insurance or other coverage, or through RX outreach, or when NeedyMeds is not able to connect you to another program that may help you to save on that medication. The NeedyMeds drug discount card is free and completely anonymous. That means we don't know who is using our card, and we do not track what medications you're getting, because that's none of our business. We only track the number of times our card is used and the dollar amount of savings. On our website, on the left-hand part of on the left side of our homepage, you'll see a large red arrow that says Get Your NeedyMeds Drug Discount Card Today. And you can click on that, or you can reach out to our call center counselors, again, at 1-800-503-6897. They will drop a card or a bunch of cards in the mail to you, and they will explain how the card works, which is essentially anybody can use the card. The only rule is it cannot be combined with insurance, and it will usually about 85% of the time the card is presented to the pharmacist, it will offer you a discount, and that discount is usually 50% off of the cash price. So thanks for that question. Here's another question coming in specifically about whether or not RX Outreach has inhalers.
Yes, we do have inhalers. We're actually in the process of changing over from the RespiClick model, the ProAir RespiClick model, to the, I think there's Advair. I'm sorry, I've got help here. And we have an Advair model, and then we're going to get a new one in. So the short answer is yes, please check our website for the specific brand and type. But yes, we have them.
Fantastic. And I will say I do see a bunch of people writing in looking for specific assistance with certain medication or product. As Pete said, the easiest thing to do is to reach out to visit his website or reach out to his colleagues, Erica or Susan, to get those specific answers. I'm just saying that because, of course, if we don't get the chance to answer you, we will get back to you via email. But in case you needed that answer today, you can certainly reach out. Another general question, I wanted to drive that home. And another general question coming in, and this is a good one. Do patients in the Medicare Part D donut hole qualify to receive medications through RX Outreach?
Yes, that's the short answer. We have a lot of Part D donut hole patients. And it goes back to that part of the presentation when I was saying, if the patient has to spend any of their money, it makes it worthwhile for them to check here because that medication that they have to buy now that they're in the donut hole is often more affordable through RX Outreach and does not affect their Medicare.
Great, thank you. And thank you again to our audience members for asking these questions, because I always say that if you're thinking of it, probably somebody else that's listening in has the same or similar question. So we do our best to keep the question segment of our webinars brief. So for those of you, again, that we didn't have the chance to answer yours, we will follow up with you via email. But in the meantime, certainly reach out to either RX Outreach or NeedyMeds. We'd love to hear from you. With that, thank you so much, Pete, for taking time out of your day to share your expertise with our NeedyMeds users. And thanks, everybody, for your time. Enjoy the rest of the day.
Thank you.